Welcome back. As we all know too well, Congress these days has a tough time with the concept called bipartisanship. The CHIP program has always been an exception. CHIP provides health insurance to children whose parents earn too much for them to be qualified for Medicaid and too little for that to be affordable when even offered by health coverage from an employer. The program costs $14 billion and needs to be reauthorized, but in its push to pass the $1.5 trillion tax cut plan, Congress ran out of time to do anything about CHIP, and as it stands right now, the program will run out of money here in Florida by the end of the month. And joining us for more is Dr. Bill Colgate of MCR Health Services, Dr. Frias Federico, a pediatrician in Bradenton, and Keith Fitzgerald, a political science professor at New College. So Keith, let me start with the politics of it all, because I don't understand this. It is bipartisan. Republicans and Democrats support it, yet they did not act on it. Why?
Well, you don't understand it because it's not rational. It doesn't make any sense. There's not some thoughtfulness to this. Just to emphasize the characteristics of this program, people have stereotypes that people who are getting some kind of government assistance are lazy, they're not working or something like this. This program focuses on families with kids who work but cannot afford insurance on their own. However, it's not an entitlement program. They have to pay for a portion, so it's just subsidized. So these are people who are doing what we want them to do, doing the right thing, and if they don't get insurance, they will cost more. So it doesn't make any sense, and it really just got caught up in opposition to the Affordable Care Act and the budget problems they caused by giving too big of a tax cut for rich people.
Okay, here's what I don't get. In the House, Democrats and Republicans support different versions of it. Vern Buchanan, our member of Congress who Adam could not get a hold of, he supports a version that would have offsets, meaning that to pay for a CHIP, you would have to cut something else, and I don't get that. We could afford a $1.5 trillion tax cut plan, but we can't afford a $14 billion annual CHIP program.
Back when the Democrats controlled Congress, back in the day, 2 different times, they operated on something called a pay-go system, which is anything you paid for had to be offset with a decrease in something else. But this is selective pay-go, a program that helps working class kids to get health care. Oh, we can't fund that unless we find the money somewhere else. But a tax cut for billionaires, that we can do, and it just doesn't make any sense.
Dr. Federico, you are on the front lines. Have you tried to contact our congressmen and our senators?
Well, we frequently tried to reach out, especially when we knew the CHIP was going to be a problem in September of last year. The main issue is that they have very little access. We call, we send emails, and the response has been less than ideal.
Well, what do you mean by that?
Well, you can get to talk to one of their helpers. They take the information. They don't get back to you. You send emails. They'll send you a nice email that they will, look into the information, but no real steps. We need these kids to get coverage.
Specifically, whose office have you called?
Both of the senators.
And the congressman, or not the congressman?
One of the congressmen.
All right. Doctor, if you could just explain again, what kinds of children fall into this category that you see who are on CHIP?
At MCR Health Services, the majority are children that are well, that need immunizations, that need preventive services, that need treatment for minor acute illnesses, as was referred to keep them from going unnecessarily to the ER. There is another small subset covered by CHIP of very complex, chronically ill children that are also covered that require very close observation by pediatric and family medicine specialists.
Okay.
Those are kids that require a comprehensive, complex care, and they are under Children's Medical Services, which fall within the CHIP.
And I would imagine that they cannot afford it to be cut off.
Of course not.
All right, we are just getting warmed up. We'll have much more on CHIP right after we check the first alert weather. Stay with us. Welcome back. We're talking about the CHIP program, and joining us for more is Dr. Bill Colgate of MCR Health Services, Dr. Frias Federico, a pediatrician in Bradenton, and Keith Fitzgerald, a political science professor at New College. Dr. Colgate, There are 220,000 children in Florida who are on CHIP, a little bit more than 3,100 in Manatee County, 3,600 in Sarasota County, and you say that you see over 1,000 in your practice alone. If this fund runs out of money, what do you do?
We'll continue to take care of them on a sliding fee schedule basis. However, the parents will often choose not to access that care, even on a sliding fee scale. Is it groceries? Is it $15 to see your pediatrician? Often groceries.
And doctor, you said that there are other things that go into it, including the fact that some parents won't choose not to go to work.
Exactly. I mean, if you have a sick child that doesn't have access to health care, they're going to delay the care until the child is really sick and going to end up in the emergency room. The parent's going to have to take care of that kid. They're going to lose time of work. They're going to be less productive. Increasing the cost of that illness is multiplied exponentially. Parents are not going to be able to afford to have access to care. That's what they need. It simplifies the illnesses. They bring it early. It will get back to work earlier rather than wait for the complications of illness.
Keith, in the end, do you think Congress is going to re-up the CHIP program?
They'll do it at the end of the day, but they have to have, what I think is really interesting and just personally appalling is you're revealing preferences here. They could have taken care of this. $14 billion in over $1 trillion budget is a drop in the bucket. They could have taken care of this right away, but they had lots of other priorities that came first. So yeah, I think they'll get it done at the end of the day, but why are we doing this? And I would just tell people in the audience who think, why should I pay tax dollars for these kids to get health care? Listen to what they're saying. If you're cold-hearted and don't care about the health care of the kids, be a business person. You're going to end up paying more at the end of this when people become acutely ill than you would have if you just gave them access to good health care.
You know, we talk about this concept all the time, but I still don't think that by and large people get this. If they are going to their own private physician like yourself with this insurance program, it saves money rather than if they have to go to the emergency room to get just your coughs and colds treated.
Correct. I mean, 80% of those visits to the emergency room are illnesses that could be taken care on their primary care physicians. And unfortunately, if they don't have access to that or they cannot pay for that, then they choose the emergency room. And it will make the cost a lot higher. I would say 100 to 1,000 times higher.
And having practiced in the emergency department for almost 20 years prior to joining MCR Health Services, the emergency departments are not set up for primary and ongoing care. They're very good at taking care of acute care. That's not what we're talking about here. We're talking about preventive medicine, treating non-acute illnesses, and teaching them healthy habits that will carry on for years and years to come. And that's not what emergency departments do, not to mention the cost.
Keith, let's go over this again. Was this program basically a victim to the attempt to repeal and replace Obamacare? Was it just, did it fall into the category, it got into now the schedule when we debated the tax cuts? Where did this go off the rails?
Well, the timing of this particular program comes due every 5 years, and it just happened to come due in the middle of the debate about the ACA and in the final version of the budget. So it just didn't get the attention that it needed to refund it, and it's really sort of ridiculous. It doesn't make any sense whatsoever, because this is a program that everyone who looks at it says it's cost effective, it's working.
If Congressman Buchanan is supporting the bill that would require you to look for offsets, meaning that you would have to cut something else to fund this, what is wrong with that? I mean, a lot of people who are watching this right now are saying, look, if you want to fund something, find some place to get it, but don't keep coming back to us.
You know, as I say, back a few years ago, when the other party had that Congress, they made everything have to pay for itself with offsets. So I'm completely in favor of that. Fiscal responsibility is a really important thing. We could find this money if we wanted to. Just think about it. We have one aircraft that has been worked on for so long. The final bill for a single aircraft will be $1 billion. That means 15 of those aircraft would pay for health care for all these kids across the country and save us money. Why can't we find that money? Of course we can find that money.
Is there a better way to offer health services to children and families who fall into this category than the way we're doing it right now?
Well, the CHIP program in Florida has a variety of programs where, depending on the parent's income, will define where do they fall. They pay a certain amount, and they are supplementing that insurance. Just to give you an idea, on ACA, since ACA came in, only 7% of the patients that were on CHIP were part of the marketplace. So the money is used, it's a budget that gets distributed among, healthy kids, Medikids, and the Children's Health Services, where the majority of more labile patient population is. Those are the chronic kids who require more intense care. They're going to lose their coverage. Those kids are going to need the multiple interventions from specialists if that money is not approved.
So Dr. Colgate, just theoretically, what would happen tomorrow if that is the day that we run out of CHIP funding?
I think you would see a dramatic increase in absenteeism in schools for kids, parental absenteeism at work, and the ERs had better buckle down.
Okay. And again, I would imagine there's an element of folks who are watching this right now who, again, say that, it's up to these parents to work, and it's up to them to earn enough money to support their families. If you cannot do that, you should not be having children.
Well, first of all, the children,
that's where they go.
No, I understand, but the children exist. They're actually here, so we can't unwind the clock and take the kids away. But look at this program and what it actually does. You know why you get the $14 aspirin and the $20 Band-Aid in the hospital? Because the hospitals deal with kids who become acute when they could have been treated earlier, and then there's nobody there to pay the bill. So they have to cost shift. So you pay for it in taxes, you pay for it in cost shifting, you're paying for it. So I would say to those people, just be smart. One way or the other, we're paying for this. We can pay for care up front and save money, and remember, this program is for working families. It's not for the unearned, so people can't pay for it.
Dr. Colgate, describe the typical family that is under CHIP that comes into your practice.
It's a single mother who works, and the child needs their immunizations. They need basic screening for any of a number of different problems, and they need access should the child get a sore throat or an ear infection to avoid trips to the emergency department. And they also want health education. They want health education that other healthcare settings aren't prepared to deal with. And that leads to ongoing wellness in addition to that one visit.
And Dr. Federico, these are families where either health insurance is not offered at their place of employment?
There are many of them that are not. There are others that are above the poverty level, so they don't qualify for services under the Medicaid. So this is not an entitlement program. These are working families. Not only that, if they have to go to an emergency room without insurance, they are going to lose a lot of the money they have in reserve for situations that they cannot afford. They're going to have a higher cost of medications. They can get preventive services. They can get immunizations, which can prevent multiple illnesses.
Keith, we only have less than a minute left, but could this also be caught up because Congress has to deal with keeping the government open in the next couple of weeks?
Well, actually, they did throw a little money into it with the continuing resolution they passed before they left. But yeah, but again, I say, it reveals your priorities. This could have been taken care of up front. It doesn't cost a ton of money. And then you could be trying to find what you're cutting in lots of other programs that are not essential to the health care of children.
All right, we have to take a quick break, and we'll be back with final thoughts in a moment. And our guests join us right now for final thoughts. Dr. Colgate, you are at the administrative end of this. You're seeing the families come in the door, but you're also looking at the books. What do you want people to take away from this conversation tonight?
I think that the take-home is, as you mentioned, well in excess of 3,000 children in our area that would be negatively impacted.
That's in Manatee, and then another 3,600 in Sarasota.
Correct. That would go away. And think if that's your child. That may seem like a small percentage of children. If it's your child, it's 100%. So there's families that'll be immediately impacted. They won't access the care that they need, or they'll access it at the wrong place. Our children are our future, and their health is their future.
Dr. Federico, what have mothers and fathers been saying to you over the last weeks when the prospect of this happening is becoming more real?
They are very concerned. Some of them even lose their coverage over time. They are not going to have the ability to have adequate care. If they don't have it, they are going to have to either hold on until the illness is severe enough that they will take the ER. Patients are scared, they are concerned because they're losing the ability to take care of their kids. Prevention is less costly than the treatment of illnesses.
Keith, if this is passed by Congress, is it likely to be on this 5-year plan again, and it's going to continually be reauthorized?
Yes, that's exactly what's going to happen. And remember, this program is a federal program, so it also has to get support at 50 different state levels to work. But you know, the point I'd like to emphasize, obviously we should care for kids, but we pay twice as much, both governmentally and out of our own pockets, for health care in the United States than any of the other rich countries. And yet our outcomes are at the bottom of that list by several measures by far. This is one of the programs that shows you how you can do this efficiently and effectively, and it's working. So it should be a top priority in the budget process. It shouldn't be an afterthought.
Again, I remember seeing congressional hearings over the last few weeks where you had just as many Republicans speaking up as Democrats on this.
The program works. Everybody admits that. And it was passed in a bipartisan way. Anybody who looks at it and does the numbers says, heck, this is a really good program. It makes a whole lot of sense. But it comes down to priorities. If you believe in these kind of, if you believe in taking care of these kids, you're going to make this happen.
All right, we'll have to leave it there. Gentlemen, thank you very much. FYI, you can watch past discussions on demand. They're available on Apple TV, Amazon Fire, and Roku. And for the latest on local breaking news, don't forget to download the updated version of our app. If your current app doesn't work, it's expired. Just go to the App Store and re-download it by searching for WWSB or My Suncoast. We want to thank all our guests for being here tonight. Dr. Bill Colgate of MCR Health Services, Dr. Frias Federico, a pediatrician in Bradenton, and Keith Fitzgerald, a political science professor at New College.